Hi everyone, this is Brenda Quijada, and the medication I will be talking about is called allopurinol. Allopurinol is used for the management of chronic gout. Gout is a type of arthritis. It occurs when uric acid builds up either because of too much production or the body has a hard time getting rid of it. The acid builds up in the blood and causes inflammation in the joints. In chronic gout, usually more than one joint is affected. This medication is also used for recurrent calcium renal stones, hyperuricemia related to cancer or tumor lysis syndrome. It also has off-label uses, such as for the prevention of ischemic reperfusion tissue damage and arrhythmias in patients who have undergone coronary artery bypass surgery or CABG. It decreases the H. pylori-induced duodenal ulcer recurrence. It's also used for the treatment of hematemesis from NSAID-induced erosive gastritis. Decreases pain in patients with acute pancreatitis. And also decreases the chance of renal transplant rejection in patients receiving triple immunotherapy. What does allopurinol do? Allopurinol decreases the production of uric acid by inhibiting the action of xanthine oxidase, which is an enzyme that converts hypoxanthine to xanthine to uric acid. Due to a decrease in uric acid concentration, there are fewer urate deposits and prevents formation of gout. This medication can be given PO or IV. If it's given PO, it's usually 90% absorbed. It is widely distributed except to the central nervous system. It undergoes hepatic metabolism and it is excreted through the kidneys. It is a pregnancy category C medication. With this medication, the dosage is adjusted for the elderly patient with impaired renal function due to the fact that it is eliminated through the kidneys. Adverse effects are pruritus or maculopapular rash. The patient can also have nausea, vomiting, an increase in liver function tests, acute gout symptoms, which include hot, red, swollen joints with pain, most common at the base of the big toe, but you can also have it at the knee, at the ankle, and small joints of the hands. There are also some serious adverse effects with this medication, which is myelonosuppression, hepatic and renal toxicity, exfoliative dermatitis, and Stevens-Johnson syndrome. With this medication, the contraindication, and the only contraindication it has, is the hypersensitivity to the drug. But you do have to have caution with patients who have chronic heart failure because with this medication you have to increase the fluid intake. And with chronic heart failure, that's technically what you're trying to avoid. And also a patient that has decreased renal and liver functions because they need to be working at its best in order for this medication to be metabolized and excreted efficiently. For patient care of this medication, you want to teach the patient to follow with the healthcare provider dosage instructions. You want to tell them to avoid to follow instructions to avoid an acute gout flare. You want to also teach the patient minor side effects such as nausea, vomiting, pruritus, and you want the patient to report if the side effects do not resolve, if a rash develops, signs of blood abnormalities, such as easily bruising or lethargic, and observe for signs of renal toxicity as well. Optimal benefits of this therapy may take up to 2 to 6 weeks, so you want to tell the patient and inform them about that they will not be seeing results right away. They need to be patient and wait at least a couple of weeks in order to see benefits. You want to tell the patient also to avoid alcohol. It can cause stomach problems and will increase uric acid level, and that's what we're trying to avoid. You want to teach the patient also foods that decrease uric acid production, such as fruits, especially cherries, dairy products, vegetables as well, but there are some that you do want to avoid, which are mushrooms, cauliflower, peas, beans, and green leafies such as spinach and kale and broccoli. You don't want the patient to consume too much of that. And also you want the patient to decrease sugar and fat in the diet. And meats, especially organs such as liver and kidneys. Seafood is also also contains high uric acid. Again, avoid alcohol and sweet bread as well. Another teaching point is that you want to tell the patient to increase their fluid intake to 2.5 to 3 liters a day to prevent renal stones and to facilitate better excretion of the acid. You want to highly encourage routine follow-ups with the healthcare provider to assess the efficacy of the medication and to see if it's effective. Signs of this medication therapy being effective is a decrease in pain and inflammation and uric acid levels being less than 6 milligrams per deciliter. And also the absence of adverse effects would be a good indicator of the efficacy of the medication. You want to also teach the patient to never start or stop medication therapy during acute flares. And these are my sources that I used for researching this medication. Thank you so much for listening.